Hey friends, it's Sunny B, future FNP, and I am back with another podcast episode. So this is becoming quite frequent, right? Like this is why I wanted to change the platform and just kind of be able to talk because I'm able to post much more frequently. So this is my NR603 update, and it is my next to the last class in my NP program, and I am super excited about that. If you listened to my previous episode, you may have heard me mention that the testing window for quizzes and midterms and finals had been shortened from Sunday to Sunday, essentially, to Wednesday to Friday. They gave us a much smaller window to take exams from Wednesday at 12:01 to Friday at 11:59 p.m. However, I am happy to share with you that they have given us an additional day. So we have from Wednesday until Saturday at 12:59. So that is great for people who work Monday through Friday. Additionally, for people like me who are in the family nurse practitioner program, most of those offices are open during business hours. So that really limited a lot of students. And apparently, a few people kicked up some fuss about it, and they were kind enough to extend us an additional day to take our tests. So I just kind of want to give you a rundown on some of the assignments that are due for this class. I mentioned previously that we will not have a final exam because we have the CEA exam in week 4 that's going to take the place of our normal midterm exam. And that test is a preclinical diagnostic test. Basically, it's assessing how much knowledge you've gained and retained throughout the program and really throughout your entire nursing career. And we just finished up week 1, where we had a classroom discussion that was worth 100 points. And we basically compared and contrasted 2 different neurological issues. That's the topic of discussion for this week 1 is neurological issues. So some people were assigned different conditions to compare and contrast. And for example, my topic was traumatic brain injury versus post-concussive syndrome, and what are the similarities and differences in those diagnoses, and how you differentiate one from the other when you're creating your differential diagnoses and when you're creating your treatment plan and so forth, and how to recognize what are those signs that let you know this is a traumatic brain injury or this person is having some post-concussive symptoms that have lingered on after a TBI. That's the short terminology for traumatic brain injury. So the person that I responded to, because we have to respond to at least one peer, her topic was dementia versus delirium. And so that was really interesting, going into the literature and responding with how to identify. We're also supposed to present some different things that kind of help guide critical thinking for our peers as well and give a substantive response. So that was pretty cool. And then in the discussion, another requirement is that we respond to our professor and the questions that she presented. Typically, when we're answering these discussion posts, you kind of give some general feedback. You talk about the pathophysiology and generalized options for treatment and so forth. But she asked some questions about specificity. Okay, so for example, if you said, I would prescribe X, Y, and Z, like this is another example, a hypertensive, so to speak, or antihypertensive. Okay, what specific medications would you prescribe? So I did hear in one of our virtual sessions that they had to help prepare us for this class, they did mention that specificity is best. Yes, we know different classes of medications, but which ones from those classes, right? So we had to respond with that. And she asked about clinical practice guidelines and knowing who are the entities that provide clinical practice guidelines for a nurse practitioner or a physician to follow when managing patients with these specific neurological disorders. And basically, we want to know what the most current evidence-based practice is. And so that was the purpose of that. And we also had to respond to a post that was presented. This was not, we didn't have to respond with like an APA resource, but we did have to respond to how do you manage delivering difficult news to a client. And we had to like present something we had encountered previously, or just in general, how would you go about delivering difficult news to a client or patient rather. For example, if there was a patient who tested positive for an STI, but they are married in a monogamous relationship, how do you go about delivering that news if their test came back positive for, say, a gonorrhea or chlamydia when they are in that monogamous relationship without passing judgment, because you don't know for sure that the spouse was unfaithful. Perhaps it was the patient that was unfaithful or whatever. We're not supposed to even think on those lines. We're just supposed to deliver the information and offer treatment in a way that does not appear to be judgmental or making any assumptions, and, being compassionate as well at the same time. So that was a really interesting discussion. I talked about something that came up in my previous practice at the bedside as a labor and delivery nurse. And in that particular situation, the ethnicity or race of the newborn was in question. And I'll give you a little bit of context. It was a Caucasian couple, and fair skinned. Mom and dad both had blonde hair and light eyes, blue eyes, gray eyes, whatever. And mom delivered an infant that appeared to be an African American baby. And that is something that comes up from time to time. And so it can present a challenge for a provider in not being judgmental and answering the dad's questions, because that's essentially what it ended up being. And he had questions about genetics and how can this be? And this doesn't make sense. And eventually you saw him like going through his mind, like this, like processing what just took place. And so he demanded paternity testing at that time. And the mom in this case was kind of just tearful and quietly shaking her head and so forth. So, as a provider, you have to learn how to navigate difficult situations and deliver news that is not necessarily desirable. So that was week 1. We also had to do our typical introductions. Y'all know I may have mentioned that I don't like doing the introduction because it's me talking to a camera about who I am and what I'm interested in. We do the same thing every class. If I was like, maybe somebody else, I would choose to just re-upload the same introduction, but I always do an authentic one. And I got through that. We also have to do like a practicum milestones validation, stating that you understand that you're responsible for obtaining 125 patient-facing hours within this 8 weeks. And they added some links for us to practice on the iHuman modules, which I've spoken about in previous videos, because my understanding is that the iHuman modules for this class are a little more intricate and not quite like the previous ones. So the more we get into this program, they just build upon your knowledge and helping you critically think from a provider standpoint. So this week is week 2, and we are focusing on mental health disorders in primary care. So I think we're talking about eating disorders, substance-related disorders, trauma, psychosis and mania, and crisis, those types of things. And we have, in terms of turning in assignments, a discussion that is worth 80 points, and then a mental health management plan. So the professor presented some questions to us via email, and we were supposed to respond to those questions in week 1 as well. And she provided us our topic for this week 2 plan analysis. So my topic, I got to click back into my email because she did tell me what my topic was, which is major depressive disorder. So I'll be diving into that, into the literature, and to complete this assignment and, get through with that. Also, of course, turning in our clinical hours and logging patient cases that we see in clinic each week. And, typical 8 weeks. Week 3 is our first iHuman encounter. Week 4 is that huge exam which they do provide us with a link to some practice questions. From what I understand, I have not yet clicked on that link, but I plan to for sure, so that I can, any type of way that I'm going to help myself prepare for this CEA pre-diagnostic exam, I'm going to do it. So if they're offering us a link apparently to something that guides our thinking on that, and like practice questions is what I've heard or seen here when I was looking through the syllabus. So I'm going to be doing that between now and the end of the week. And then in week 5, we're on gastro diseases and disorders, and the body does not change, right? So we go through these different systems often, and each class is just building upon knowledge and helping you get stronger clinically for decision making. So no stranger to the gastro system, but we just continue to expand. And then week 6 is endocrine and autoimmune disorders. And week 7 is managing emergencies in the primary care setting. I can say that in clinic, there have been 2 times that we've had to send someone over to the emergency room. So emergencies do happen in the primary care setting. Sometimes people come in and they're in diabetic ketoacidosis, just those things like that. And then week 8 is complex conditions affecting the renal system. So your kidneys function and all of that. And again, there is no final exam in week 8 like normal. And so I'm ready to get my feet wet and, hands dirty, so to speak, here in this class. And I guess my biggest update was that we do have an additional day to take our exam. So that's pretty exciting to most of us. And I do want to just kind of chime in about clinical hours, right? So in addition to being a student, I am also a visiting professor 2 days a week, and I also own a spa. So between managing the spa, which I don't work in there as much as I used to, but I do still have clients sometimes. But most days it's my team that's working in there doing their thing. But in between managing that and being a professor and a student, sometimes I don't feel like going to clinical, right? There are going to be some days that you just don't want to do it. For one, I have a lot of competing priorities. And today I was planning to do a half day at the pediatrics location, but I'm just not feeling it. So having a backup clinical site is critical for those times that you have to maneuver sometimes. And instead of doing a half day today at the pediatrics office, I'm going to do a half day at the internal medicine that is very close to my spa, because tomorrow happens to be a day that I have 3 clients myself, 2 of them in the morning and 1 in the evening. So I have like 3-hour window in between those clients where I can go 2 minutes away from my spa. I'll be able to go and do clinical hours there. So you have to just find ways that work with your life so that you're not all over the place and feel like you're stretched so thin. So that's just called smart working. Work smarter, not harder. Like we got enough things to focus on as students and just as people in general, right? So today I'm spending the afternoon studying. I'm going to go through those practice questions that I mentioned, and that allotted me time to make this quick episode. So yeah. But that's what I'll be doing. I also need to log my hours from Friday because I didn't have time over the weekend. For one, I was a little bit tired, and then I had stuff to do over the weekend that I have to grade my students as well. And that took up a little bit of time. So today I'll be logging stuff from Friday, all the patients that I saw, and just kind of preparing for this week. So I do try to work in at least one day or at least a half a day throughout the week where I just have time to get caught up on things or get ahead. Being ahead of the 8 ball is good. And oftentimes that doesn't happen because this program is like a steamroller, it's this fast pace. We roll forward, push through. So I'm used to that pace. That's no problem. But sometimes I still need to catch up on stuff. So here we are. And thank you so much for listening. I kind of went a little bit longer on this episode, but I appreciate your ear and thank you for joining me. And thank you for everyone who's subscribed so far. I'm not in this to become a famous YouTuber. I just want to share my journey in the hopes that it helps someone along the way as well. So I hope you enjoy the rest of your day, and I will speak with you in the next episode. Take care.